Hi, I'm Julie Tanguay-Gordon.
I'm Sonia Marcel.
And I'm Joanne McNeil. We're registered dietitians at the Ottawa Hospital Cancer Centre.
We have developed videos in French and English on the nutritional guidelines to help manage some of the common side effects of cancer and cancer treatment.
Remember, everyone is different. Follow the suggestions that feel right for you.
Are your bowel movements more frequent and watery than normal? Do you have a sense of urgency to go to the bathroom? Are you experiencing abdominal bloating or cramping? If you've answered yes to any of these questions, you may be experiencing diarrhea. In this video, we are going to discuss which foods you can eat and which foods you should avoid if you're experiencing diarrhea or gas. Diarrhea is a health condition that involves the frequent passing of loose or watery bowel movements. There are many causes of diarrhea. For patients living with cancer, diarrhea is often related to the location of the cancer, the treatments you're receiving, such as radiation, chemotherapy, or surgery, stress, and in cases where a bowel obstruction is present. If you are experiencing diarrhea, changing your diet might make a difference. A low residue, low fiber diet allows the intestinal tract to rest and helps control diarrhea by limiting the amount of food waste that has to move through the large intestine. There are lots of food options to choose from while following a low residue diet. In the fruit department, reach for peeled apples, pears, peaches or plums, canned fruit, applesauce, seedless melons, mangoes, papayas, and bananas. Try to avoid fruits with skins or seeds which you cannot remove, dried fruits, all berries, fresh pineapple or rhubarb, prunes, and prune juice. When it comes to vegetables, choose only peeled and cooked options like green and yellow beans, asparagus tips, cauliflower, carrots, turnips, squash, beets, potatoes, sweet potatoes, and tomatoes with no skin or seeds. Make sure to avoid all raw vegetables including salads, cooked cabbage and coleslaw, Brussels sprouts, broccoli, corn and peas, green leafy vegetables such as spinach or kale, bean sprouts, and eggplant. For breads and other grain products, your choices include all white or refined breads, buns, crackers, cereals and desserts, as well as barley, regular pasta, white rice, rolled oats, and tapioca. You should try to avoid products with nuts, seeds, and dried fruit, whole wheat and whole grain breads, cereals and pasta, brown and wild rice, granola, taco shells, and wheat germ. Your choices for meat and meat alternatives include lean cuts of meat and poultry, fish and seafood, eggs in any form, smooth peanut butter, and plain hummus. Stay away from tough, stringy meats, chicken fingers and wings, deep-fried or battered fish, legumes such as baked beans, lentils, or pea soup, as well as nuts and seeds such as peanuts or sunflower seeds. You may continue to enjoy milk, milk drinks, cheese, cream soups, puddings, custards, and yogurts, but try to avoid ice cream with nuts and yogurt with berries. This food group may cause you some difficulties such as bloating, cramps, and diarrhea. If you are lactose intolerant, the use of an enzyme or lactose-free products may be necessary. Additional items that are safe to consume include Jell-O, honey, syrup, jelly, sugar, margarine or butter, mustard and ketchup, as well as soya sauce, chips, and pretzels. If you can, try to avoid pickles, olives, popcorn, corn chips, jams, coconut, candies with nuts or seeds, and spicy foods. Please visit our website for a complete list of food items. If you're having diarrhea, try to choose foods that contain soluble fiber, combined with drinking lots of fluids. These foods have binding properties which will help form your stools and make them easier to pass. The list includes applesauce, bananas, peeled and cooked carrots, potatoes or sweet potatoes, smooth peanut butter, white bread or rice, rolled oats, barley, and tapioca. If you are experiencing excess gas, try avoiding cabbage, onions, cucumbers, broccoli, cauliflower, melons, whole grain products, beans and legumes, high-fat foods, carbonated beverages, and try sipping your fluids instead of using a straw. When experiencing diarrhea, it is important to stay well hydrated. Aim for 8 cups or 2 liters of fluids each day. These fluids should be non-caffeinated and non-alcoholic. For every loose or watery bowel movement, add 1 cup of fluids over and above your 8 cups per day. Good options include water, diluted non-acidic juices, nectars, consommes, soups, flat, clear soft drinks such as ginger ale, sports drinks, or oral nutritional supplements such as Ensure. For more fluid options, make sure to view our video on hydration. Additional tips include eating slowly, taking small bites, and chewing your food well. Consume small, frequent meals and snacks as opposed to 2 to 3 large meals every day. And take your anti-diarrhea medication as prescribed. It is important to call your healthcare team if your diarrhea persists for more than several days, you feel weak or dizzy, or if you develop a fever or severe abdominal pain.
We hope you found the information useful. Please visit our website for more tips and handouts on dealing with side effects and symptoms.